Good evening. This evening, I would like to talk to you about a topic that's very near and dear to my heart. Anytime I tell someone that I used to work at a dermatology office, I get one of two responses. The first is, so you all do what Dr. Papa Pimper does. And the second is, so you all make people look good. And in a nutshell, the answer to both of those questions is yes. However, it isn't all that we did. It wasn't even our main concentration. You see, our primary focus was early detection, prevention, and treatment of skin cancers. There are several forms of skin cancer. Today, I like to focus on basal cell carcinoma. Now, when I first heard the term basal cell carcinoma, I thought that it was pretty bizarre, given that its first name and my first name pronunciation is the same. But in 2020, when my company had to downsize due to COVID, individuals who retained their jobs had to take on additional responsibilities. One of my additional responsibilities became educating patients when they had skin cancers that needed to be treated. But before I could do this, I had to prepare myself. So one of the surgeons and I met every day for 2 weeks, excluding the weekend. During this time, we meet for about 3 or 4 hours at a time. And during this time, we would research, read, role play, discuss possible objections that patients would give me and ways that I could rebuttal and overcome those objections definitively. Today, I would like to share some of that knowledge with you. Learning outcomes that I expect for us to get is a brief summary of what basal cell carcinoma is, what causes basal cell carcinoma, what can be done to prevent it, and treatment options for basal cell carcinoma. Let's begin by looking at what basal cell carcinoma is. So basal cell carcinoma is cancer of the basal cells. This occurs in the outermost layer of our skin and is due to overexposure to radiation and ultraviolet lights. According to an article posted in the Cancer Source book, the 6th edition, written by Bellinaire, it is the most common skin cancer. Today, let's talk about the 3 different types. Many different types, but let's talk about 3 of them. Nodular basal cell, it usually appears as pale, but it is a nodule. Superficial basal cell carcinoma, it's round with a ring at the border. And pigmented basal cell carcinoma usually have an inversion of pigmentation in it. Now that we have a general idea of what basal cell carcinoma is, let's look at some of the possible causes. Much of the cause of basal cell carcinoma is due to damage of the DNA inside of the basal cell. Mayo Clinic posted an article in May of 2021 stating that there are many factors that contribute to basal cell carcinoma. Additionally, the Skin Cancer Foundation posted an article in 2022 that advised that 90% of all non-melanoma skin cancers are caused to overexposure to sunlight. Because basal cell carcinoma often takes decades to develop, it is usually found in older adults. However, in our clinic, we have seen patients who had basal cell carcinoma in their 20s and 30s. Now that we've explored some of the risks to basal cell carcinoma, let's look at some of the possible ways to be proactive against getting a basal cell carcinoma. I will concentrate today on 3 main points. So there are several ways to be proactive against getting a basal cell carcinoma. However, if you have been exposed to rays all your life, say you are a beach goer, in your 20s, your 30s, and your 40s, and in your mid-50s, you decided to start being proactive, you have to understand that damage has been done and it's important to consult a physician. The first was released in the same article that I referenced earlier by Mayo Clinic in 2021 that advised that try avoiding the sun during the times when its rays are the strongest. This is typically between 10 a.m. to 4 p.m. So avoiding sunlight when the rays are at its strongest will be one way to help prevent against basal cell carcinomas. And always wear sunscreen. Early in the morning, late in the evenings, you always want to put some sunscreen on. And it's important that you wear sunscreen that has the active ingredients, zinc oxide and titanium. The third way to really be proactive against getting a basal cell carcinoma is doing daily skin checks on yourself. Also, scheduling yearly exams with a physician, a board certified dermatologist, and immediately reporting any lesions that itch, bleed, hurt, sting, or have changed in shape, size, or color to your physician to let them know that you're experiencing problems. Knowing what basal cell carcinoma is, understanding what causes it, and taking preventive steps to avoid getting them is all collectively a game changer. But in the event that you were to get a basal cell carcinoma, let's look at some of the possible treatments for basal cell carcinoma. The first treatment is going to be electrodesiccation and curettage. This is when the physician goes in and burns the cancer where it is and then scrapes it with a cautery. The second would be the Mohs procedure. So the overall 5-year cure rate with Mohs procedure has been 99%. This is according to an article posted in the British Medical Journal by Dr. Wong. This procedure is to preserve as much of the skin as possible. So the doctor would go in and take a superficial shave and send it to the dermatopathologist. The dermatopathologist sends it back and says, yes, this patient does in fact have basal cell carcinoma. The doctor would set up a surgery, and on the day of the surgery, the doctor would shave the margins of the surgery. He would take it into his lab and review it under a microscope to determine if all the cancerous cells around it are clear. If it's clear, then he'll come in and let you know, and we'll get you prepared to leave. In the event that the cancer spreads beyond the margins that the physician took, he would go in and take another layer. This is to preserve as much of the skin as possible. This procedure is very effective for individuals who want to preserve their skin. In conclusion, we have examined some of the highlights of basal cell carcinoma. We touched on what basal cell carcinoma was, what are some of the causes for basal cell carcinoma, and preventative measures we can take to avoid basal cell carcinoma. Most importantly, we addressed possible treatments in the event that we were diagnosed with basal cell carcinoma. I hope that I have said something here tonight that helps you to live and lead a better life as it pertains to your health and your skin. Thank you and have a great night.